Alright, let's talk about hyperpigmentation. It's such a common problem and so many of us are looking out for that one magical solution. But actually, what really works?
So yes, I hear this question all the time. There are a lot of options, but one should know that most importantly, treating hyperpigmentation is a journey, not a quick fix. So we should do a combination of treatments. Consistency is very important and patience.
What do you usually recommend to our clients for hyperpigmentation?
So chemical peels are a good start. They exfoliate the top layer of the skin, making the skin more brighter and also treats the superficial pigmentation. So we have a various range of peels ranging from glycolic acid, lactic acid, mantelic. Depending upon your skin type and concern, we will be giving multiple sessions of those treatments. And whenever you are having deeper pigmentation, we would like to use lasers such as Q-switch NDAG, pico lasers to treat the deeper pigmentation.
So if someone is thinking of getting a chemical peel done, what should they expect?
So basically it takes few minutes. There might be a mild tingling sensation during the procedure, but it's very tolerable. For some individuals, there might be a skin peeling, very superficial depending upon the peel they are getting it done, and they should be spaced few weeks apart between each number of sessions. And obviously you will start noticing results with 2 or 3 sessions.
So basically when we talk about this hyperpigmentation, like there are like people talking about peels, how do you recommend Q-switch lasers? Which is the best to get started with?
So ideally to start with, they can always start with a peel, and then we will be evaluating their pigmentation, and if they have deeper spots, we would give them few gaps in between. For example, once we have done a session of peel, we give a gap of 2 to 3 weeks between the next session, and accordingly we might do a laser or peel for the next session. And Q-switch laser, it focuses on the specific spot rather than damaging the surrounding skin. It can target the melanin, the pigment forming cells, and breaks the melanin. Plus, maintenance is very important.
So how does this maintenance, because everyone gets scared when they want to get a chemical peel done, there's a lot of maintenance, they cannot step out in the sunlight. So what one should be doing to just get the best results out of chemical peel?
So the basic thing is, once we are done with the chemical peel session, we should make sure you're applying your moisturizer and your sunscreen at regular intervals of 3 to 4 hours. And always remember the 2 finger length rule, that it's not about you're applying sunscreen or when you're applying sunscreen, it's also about the quantity you're applying. So 2 finger length if you're applying, it will give you 97% of protection for 3 to 4 hours. So if you're planning to apply once in 7 hours, a very little amount, it hardly gives you around 10 to 15% protection, and always it will bring back your pigmentation back. So most important thing after a peel is sunscreen.
So what about these vitamin C and retinols? Like, should we stop during the chemical peel? The whole process should we stop, or like can we start immediately after the procedure?
So basically we give an ideal gap of 5 to 7 days before the procedure and 5 to 7 days after the procedure. One should stop all your actives, and you can restart your actives with retinols, with your anti-pigmenting agents, and be restarted after 5 to 7 days.
So for a hyperpigmentation, the best thing to get started is with the boosters, and then combine it with chemical peels and laser, and have a best maintenance which includes the moisturizer, sunscreen.
Yes.
After 4 or 5 days later, get started with your retinols.
Yes.
Thank you, doctor. That was really informative. And for all of you watching this video, I'm sure you got that magical solution for fixing up your hyperpigmentation. For further queries, do comment us in the comment section, and we will see you soon in the next video.